is Jacqueline Avalos, and today we will be talking about nursing, breastfeeding, alcohol use. Throughout the first part of this presentation, I will be talking about the benefits, the problems and complications, life benefits, and mom's health for nursing and breastfeeding. So for the benefits, the first and most important benefit is that your baby will be healthy with a stronger immune system. This is because in the breast milk, mom already carries the antioxidants, the enzymes, the nutrients, and the immune properties that the baby will need to be strong and healthy. For the second benefit, it's a less digestion problems for the baby. So the baby will have less chances of diarrhea, less constipation, and less chance of gastroenteritis. For the third benefit, the baby will have fewer respiratory illnesses. These are things like asthma, pneumonia, and whooping cough. For the fourth benefit, the baby will have better eyesight. Like I said before, mom carries all the nutrients that the baby needs instead of formula, so this makes for a better eyesight as well. The fifth benefit is overall illnesses. If you give your baby breast milk instead of formula, once again I mentioned the mom already carries the antibodies and the nutrients and the enzymes that the baby needs. So other illnesses would be things like ear infections. When you're a baby, you get those all the time, and unfortunately, because you are a baby, you can't communicate with your mom that you have an ear infection. Other things would be meningitis, allergies, eczema, type 1 and 2 diabetes, and Crohn's disease. As a baby grows up, feeding him or her breast milk when they're babies will also reduce the chance of them being obese in the future. Some problems and complications are latching, milk supply, skin crackling, soreness, blocked milk duct, and mastitis. So for latching, the baby may or may not latch on quickly or as quickly as you thought they would. Or they might not want to latch at all. I know it is harder for premature babies to latch. For the milk supply, this could go either way. You can have way too much milk or very little milk. So when you have less milk, you want to try to feed the baby constantly to make more milk. If you have too much milk, the solution is obviously to feed the baby when their feedings are due, and if you still make more, you can pump and store away the milk, freeze it for later use. If your skin is cracking, it's because the baby might not be latched on correctly, or not positioned well. This might lead to soreness, to tenderness in the breast, for them to be sensitive. So just try to reposition the baby so they can eat better. Blocked milk duct. This is due to your breast engorgement. This might be fixed with frequent feeding and pumping. So like I mentioned before, if you are producing too much milk, you can always pump and that will relieve it a little. And mastitis, this is inflammation in the breast. So again, with the blocked milk duct, if you are producing too much milk and you're not getting all of it out, that's the way you can relieve it, by pumping. Mastitis will make your breast feel hot and painful, and it will give you flu-like symptoms. Not every woman is the same, but usually the symptoms will be flu-like. For life benefits for the child, they are less likely to develop diseases. Um, there are fewer cavities when they are growing up, fewer speech problems because they're working their jaw as they eat, less chance to become obese, like I mentioned before, and greater immunity to infection. For the mother, there's less chance to develop breast cancer, less chance to develop heart disease, less likely to develop arthritis and lupus. For mom's health, it helps her emotionally, physically, and mentally. For emotional, the hormones that she is making are natural soothing hormones. So things like oxytocin and prolactin, that those two produce or promote stress reduction. For confidence, the baby is with you, so you're confident. Then you can do this. You're emotionally soothed by the baby, and you're in a better mood. You're not as much pain. You have skin to skin contact. You're holding the baby and you're cuddling with the baby, and it just brings you to a positive mood. For physical breastfeeding, you can lose weight faster. So when you breastfeed, it's about 500 calories that you're burning a day. So that will make you lose or help you lose weight faster. You have less bleeding, postpartum bleeding, and less chance of anemia. Because you're bleeding less, you're less likely to become anemic. For your mental health, you're calm because the baby is not crying as much because you're breastfeeding. You are calmer, and it's less worries when you go out shopping or you have to go to the doctor's office or you have to do all these other activities. You don't have to worry about, where am I gonna heat up the water for the milk? Where am I gonna wash my hands for, all these things? Where am I gonna rinse the bottle? Because you are the supplier. Your body is ready for the feeding of the baby, so you don't have to worry about bringing anything extra with you. For the alcohol use, we're going to talk about the safety, the alcohol in the breast, and the issues and problems that this causes. So for the safety of you and the baby, just don't drink it. It's so simple. Just don't drink it. But if you are going to drink, moderate it. Have a one drink instead of, however many you would usually have. It damages the child's development, their growth, and their sleep patterns. The alcohol in the breast milk, can you detect the alcohol in the breast milk? Yes. Yes, you can. For how long? The strongest the alcohol is in your breast milk is 30 to 60 minutes after you have consumed it. But it can be detected in the milk for 2 to 3 hours after it's been consumed. One drink will be 2 to 3 hours. Two drinks will be 4 to 5 hours, and three drinks will be 6 to 8 hours after you have consumed it. That it stays in your system. For the issues and problems, we're going to talk about milk ejection, shortness, breastfeeding duration, sleep patterns, development, and growth. So milk ejection is one of the issues. Shortened breastfeeding. So because you are drinking and you're putting alcohol in your body, maybe the baby doesn't want to latch on or won't latch on properly. That's gonna make your feedings shortened because you're gonna produce less milk. Because you are drinking, now the alcohol is in the baby's system and it might mess up their sleep patterns. They will reduce or decrease the amount of sleep by 20 to 23%. for development, it will affect them in the long run because their motor skills will be uh, messed with. Their cognitive development will also be affected, and with growth, they will reduce the ability to have better abstract reasoning, and this will happen in the ages of 6 to 7 during school. Some tips I have before birth, before you even might get pregnant, is self-care. You have to take care of yourself, have a healthy diet, work out regularly, or if you're not going to work out, go for walks. You have to eat in your diet, have to have the 5 food groups at least. Talk to your doctor. You need to let your doctor know that you want to breastfeed beforehand so they can direct you in the right direction. So they might give you more resources to look at, pamphlets. They might help you out and give you some videos and some tips beforehand. You can take classes if you would like. Some hospitals do offer classes to help you practice, and they might tell you the things you need. So some of the things you need are going to be nursing pillows, nursing bras, some covers. Some women do like them, some don't, but either way, you might need it. And ask to see if your insurance covers a pump. You might not need to buy one, and because your insurance covers it, you might get it for free. The 101 on breastfeeding. So the babies will usually be ready to eat 1 to 2 hours after they are born. So some tips are obviously wash your hands. Position your baby. The picture right here shows 4 ways you can hold your baby so you can breastfeed. 3 would be place your thumb of your free hand, the one you're not holding your baby with, and the rest of your fingers underneath your breast to feed the baby. So you just don't, you know. For the 4th one is your nipple has to touch the baby's mouth, but don't force it in there. They will open their mouth when they are ready. And for the 5th, put the nipple all the way in your baby's mouth after they have opened it, and pull the baby close to you. Don't, have them too far from you. This lets your baby's jaw squeeze the milk ducts under your nipple. The way you know that your baby has latched on correctly is both of the lips should be pouted out, and they should cover most of your areola. The jaw should move back and forth, and they should make some low-pitched swallowing noises. If when the baby is doing that, your breast hurts, try to reposition the baby because it might have not latched on correctly. So it will continue to hurt and it will make your breast sore or swollen. Are they eating enough? So when the baby acts satisfied, that's how you know that the baby is done eating, that they are eating enough. The baby should wait more after the first 3 to 7 days of birth. Another way you will know is if your baby has 6 to 8 wet diapers a day, and 2 or 5 more stools a day at first. Obviously, as they get used to eating, maybe they'll decrease to 2 stools or less a day. Your baby might be hungry for 8 to 12 times a day at first. They will reduce the times they are hungry a day as they grow older. So when they go through growth spurts, they might eat less. So the first growth spurt that they might have is from 2 weeks to 6 weeks after or of age. And then the second one should be 3 months to 6 months of age. When you are breastfeeding and you want to know if they have had enough, you want to make sure that your baby eats out of both breasts for maybe 15 to 20 minutes per breast. They have to finish eating out of one breast before they can start the next. When your baby is done, they will let you know that they are done because they will let go of your boob. They will let go of the breast and they will be finished. You also have to remember not to rush the feedings because this will create then your blocked milk ducts and you will start producing less milk. This will also make it harder for the baby to latch on because since you're creating less milk, they will stop feeding faster and you won't produce as much milk as you should be. If you do rush it, then you will make yourself have swelling and pain because you're not feeding the baby as you should. If you happen to have any other questions, obviously you can go back to the hospital. You can ask more questions to your doctor while you're in the hospital or before you are released from the hospital. They do have other ways to help you in case maybe the baby doesn't latch on correctly. Like I mentioned before though, if the baby is a premature baby, they will have a harder time latching. So make sure you just ask your doctor for all the information before you give up. Don't forget that breastfeeding will be way more beneficial than formula for your baby. I hope I gave you all the information and I hope you have a good day. Bye.